Hello and welcome to Crown Point Optometry and our video about glaucoma. So a lot of people have misconceptions about what glaucoma it is because it's quite a confusing condition. And one of the reasons why it's a little bit confusing is because there's multiple types of glaucoma. So we're going to start by talking about the two major different categories. So glaucoma is damage to the optic nerve. The optic nerve is what transmits the information from your eye to your brain. And again, if that information gets kind of lost in transit, that can cause some loss of vision. The most common reason for this optic nerve to get damaged is if the pressure in the eye is too high. The two types of glaucoma are open-angle glaucoma and closed-angle glaucoma. Closed-angle glaucoma is where the drainage of fluid in the eye is blocked off or closed off completely. So this means the pressure in the eye can go very, very high, very, very quickly, and it's considered an eye emergency. Open-angle glaucoma is where there's an imbalance in the production and the drainage of fluid. So the fluid is still draining, but not quite at enough of a rate to match the production, so that the pressure is slightly elevated, kind of more of a chronic condition. It's not considered an eye emergency, but both kinds of glaucoma can cause damage to the optic nerve and therefore to the vision over time. The thing about vision loss from glaucoma is it doesn't start right in the center. It tends to start in the periphery off to the side and then gradually, slowly sneaks in. So it can actually be very, very late in the process before somebody notices any symptoms. The next thing I'm going to talk about are risk factors for glaucoma. There are several different risk factors. Unfortunately, like for many things, one risk factor is age. So older people are at high risk of glaucoma for younger people just because the pressures will have had that much more time to potentially damage the optic nerve. Family history is also important. If you have a family history of glaucoma, you're at a higher risk yourself, again, just like many other conditions. Another risk factor is the anatomy of the optic nerve itself. Some people have larger or smaller optic nerves naturally, and larger optic nerves are more susceptible to damage than the smaller ones. A fairly controversial risk factor is diabetes. People with diabetes are diagnosed with glaucoma a little bit more frequently, but it's unclear whether it's because they get more eye exams, so it's diagnosed earlier, or whether it's because diabetes in itself causes glaucoma. Sleep apnea is an interesting one because even with normal pressures, the lack of oxygen that happens in sleep apnea can also cause damage to the optic nerve itself. So that's another more recently discovered risk factor. The last one that I'm going to discuss is the thickness of the cornea. The cornea is the front of the eye, and for reasons that are not entirely understood yet, if the thickness of your eye is thicker than average, you're at a lower risk, and a thinner eye is at a slightly higher risk. So now I'm going to go into possible treatments for glaucoma. There's two major categories of treatments for glaucoma. One of them is surgery and one of them is drops. So we'll start by talking about surgeries. There's several different procedures involving lasers and stents and things like that that can reduce the pressure of the eye. In developed countries like Canada and the US, that doesn't tend to be the first line, just because we have a lot more access to medications, although in some developing countries, that's actually a first-line treatment because then it means that the people are going to access to the care once and don't need quite as much follow-up. The other option, there's medications that reduce the risk or reduce the pressure in the eye. And these are normally in the form of eye drops, so there are also some pills as well that are for that. The thing is, these medications do need to be taken consistently over a long period of time in order to keep that pressure low, although they are effective when people take them. So thank you very much for listening to our video. We were talking about the different types of glaucoma, the risk factors, as well as what people can do about it. So thank you for listening, and hopefully you'll enjoy the rest of the channel about Crown Point Optometry. Thank you.